Good morning, everyone. Thank you so much for joining our virtual talk today for the MIT Club of Australia. Today, it's my great honor to introduce Joy, who is going to be presenting a talk called Biohacking with the Sauna, a new tool in lifestyle medicine. And I will say from my side that sometimes, as a scientist, probably like many people who study at MIT, I can be a bit skeptical of complementary medicine. However, with Joy and her extensive background, I'm really interested today to try and have a bit more of an open mind and really think about some of these other tools that maybe sit outside of traditional medicine that may be things that actually could be really helpful for us. So that's my personal perspective. Other people may have different views. But Joy has an absolutely incredible background to investigate sauna. She studied at MIT. She graduated in 1986, studying course B, which is molecular biology. She then went on to get a medical degree from Case Western Reserve University School of Medicine. And she practiced for more than 20 years as a GP in many different places, remote places in the United States and in Australia. She then became interested in sauna at some point, and I'm sure she'll tell us more about that. And she was so dedicated to trying to understand it that she actually completed a PhD in complementary medicine here in Australia at RMIT. She currently runs here in Brisbane a practice called Health with Joy, which is an integrative medicine clinic where she uses wearables and she encourages people to use sauna. And I'm sure she'll tell us more about what she does in her practice, but trying to have a really holistic view to health, including sauna. With that, I'll hand over to Joy. And what I'd like to say is, if you have questions, please put them in the chat and we'll get to them at the end. If you have a burning question, something that needs clarification, raise your hand. I will stop Joy and let you ask your question. But let's try and let her get through the talk and we'll save the questions mostly for the end. Thanks very much. Joy, over to you.
All right. Well, hey, thank you, Evelyn. That was probably the best introduction I've ever had. Anyway, so as Evelyn was pointing out, I became interested in saunas. I was clueless about saunas, actually. I grew up in San Diego, California, and hadn't had any experience until I worked in a small town in Alaska as a family doctor for several years. And my husband and I, while we were living there, we started sauna bathing mostly for social reasons. It was what we did in the wintertime, and there was no public sauna. We went to people's homes and used their saunas. And it wasn't until we moved back to Australia, my husband's Australian, and lived for several years without a sauna, and then rebuilt a sauna and started using it again, that we started to appreciate the health effects. Prior to that time, it was only social and indulgence that we thought we were doing. And it was at about that time that I met Professor Mark Cohen, who was also interested in saunas, and said, "Oh, there's not a lot done on this space. Why don't we get some studies going?" And that's how I got interested in it. I realize this is a bit of a low-tech subject for this high-tech crowd, but I'm hoping by the end of this, you are as intrigued and fascinated by some of the evidence that's coming out about saunas as I've been for these past 10 years or so. So just to get us warmed up, and no pun with that, no pun intended with that, but if people could scan that link, and I put the copy of the link in the chat, if you could just do take the time to do these 3 questions, it'll really be interesting. And I'm hoping it's going to come through in real time to get a sense, and it might be that I need to refresh it. So let me see, because we tried this out, and look, oops. Let me just try and move this, because it's really fun to see how many people are already using the sauna. Let me go up here, and let's just see if it's populating. No, I'm still only getting the one response that I did at the beginning. So, anyway, if you could put your response, or maybe we'll talk about it in question and answer, because it's really fun to go over why
We don't
people
have a
are
lot
using
of
sauna.
participants. Maybe everybody could put it in the chat, these 3 questions, just a suggestion.
Perfect. That's a great idea. Let's go with
So
that.
maybe if you
So
could just slowly go
in,
through the questions, then people can put their answers there.
okay, why don't we do that? So the first question is, do you routinely use a sauna? And it doesn't show up there, but at least once a week is what should be there. The second question is, if you use a sauna, which type do you use? If you know, and just choose one, even if you use multiple ones. I'm just curious in the one you use the most. And then the third question is, why do you use the sauna? And I've offered you responses that are the most typical, but I'm really curious if anyone has responses that are outside of that. And we'll go over that in the question and answer. So let's not get hung up on that. But what we should do is first discuss, what do I mean by sauna and what is meant by sauna in the medical literature. And sauna, which is a Finnish word, really just refers to a room or confined space that contains heated air. And the type of sauna is determined by, how is that heat generated? Is it electric or wood burning, which is typical of a lot of the traditional European saunas, or is it infrared generated, the way it is in a lot of saunas that are in Australia and the US? And the level of moisture in the air. What's the relative humidity? Because there's wet and dry saunas. Both traditional and infrared are examples of dry saunas where the relative humidity is usually less than 20%. Whereas steam saunas, which you're going to hear a lot about too, tend to have humidity over 80%. And these are more common. Sometimes they're, like I just said, wet saunas, or they're popular in places in Russia, and there's also just many different types in between. And the materials of construction also help determine the type of sauna. And there's a lot of new tent saunas that are getting popular, and that gets figured in too. And not all of these different types of sauna have the same physiological effects. And that's something that in Biohacking with the Sauna, we're going to go through. And also, what's not a sauna? A jacuzzi, hot springs. Those are not saunas. That's a different type of physiological response, water immersions. So keep that in mind as we're talking. So at the beginning of my studies, and this was about 2013, I first did the first systematic review of saunas in health. And what I found at the time is that there were some issues with some of the saunas. First of all, there were only a couple hundred studies since 2000. That's when I kind of noticed medical interest in saunas started getting generated, was starting about 2000. And what I noticed is most of the studies studied men and not women. And can everyone see that? I just want to make sure. Are the slides looking okay?
Yes, the slides look great, Joy. We can see them fine.
Okay. So one of the first issues is that men were by far more studied than women in the saunas. And I get it. As a researcher, women, you would have to standardize their periods, especially if they're premenopausal. And that was a major pain. So it's so much easier to study men when we're looking at any kind of thermoregulation issues. There were several really good cohort studies, but unfortunately, they're all done by the same research group in Finland, and we're going to talk through those. And really, most of the interventional studies, and again, I'm going back to about 2015, this got published in 2018, there weren't that many randomized controlled trials. There were only 40 studies overall that I thought met criteria to be included. And this is criteria of studying humans, not animals. I was amazed how many research groups have tried to study our thermoregulation by sticking hamsters and rats and into saunas. Those poor creatures, they do not thermoregulate like us. They pant. And that's a real limitation that we need to be mindful of when we're looking at studies around and findings from sauna studies, is make sure they're done in humans, even for mechanistic purposes. A lot of the protocols, they were mixing the types of saunas, and they were scattered across different disciplines. Cardiology by far, which we're going to go over because cardiovascular benefits definitely outshines what's been studied in the medical literature by far. But also sports scientists, exercise physiologists have been involved a lot in this. There's some good studies out of dermatology, and then there's emerging studies in the psychology and psychiatry issue too. And there's all kinds of funding and bias issues as well. But as I said before, by far, it's cardiovascular benefits that have been most demonstrated. And the series of observational studies that just shine the most come out of Finland. Jari Laakkonen's a cardiologist who had the foresight to study saunas, or actually to do an observational study of Finnish men. And it was quite a good one. It was well set up. He followed over 2,000 Finnish men for over 20 years. And when this first study came out in 2015, I had just started my PhD and was starting to get a little wondering if I'd really done the right thing, questioning my motives. But reading this first article by Laakkonen just was the universe validating that I needed to keep doing this, because he when they did the first set of number crunching after 20 years, they saw that there was a decreased risk in all-cause mortality by 40%, and there was a decreased risk of sudden cardiac death by nearly 2/3. These are not numbers to laugh at. These are the kind of findings we see when we observe people stop smoking or start exercising or start controlling their blood pressure, taking blood pressure medications. So this really made a big splash in the medical literature back in 2015. And then he and his research group went on to publish several other sub-analyses looking at dementia, decreased risk of dementia by 2/3, decreased risk of developing hypertension by nearly a half, and decreased stroke risk. And again, these are pretty remarkable numbers. Now, of course, they're all coming out of this one population of men in Finland, and obviously we need to look further than that. But there's also some good interventional evidence coming out of Japan. Now, there's a Japanese researcher that the reason this doesn't always get captured is it gets referred to as WAN therapy, which is a type of infrared sauna, usually 15 minutes at about 60 degrees Celsius, followed by 30 minutes of laying under a hot blanket afterwards. And there's some remarkable findings that come out of that studying heart failure patients. So, and in fact, this is incorporated in several hospitals in Japan as part of cardiac rehab, which again there's a lot of irony in that, considering that most of the public saunas, at least here in Australia, have a big placard saying, if you have a heart condition, please consult your doctor before getting into the sauna. Really, I think when we're going to be talking about this, we should be saying consult your doctor about a sauna prescription. I'm hoping that'll be in the future, because actually that's the population that could benefit the most based on the evidence we have so far. And these are some of the types of, and it was a pretty good multi-center randomized controlled trial with meta-analysis. And meta-analysis is difficult in the sauna literature, because to conduct a decent meta-analysis, you need enough numbers and you need enough different places for it to make meaningful. And that's been a challenge. So what are the mechanisms? How is sauna bathing, whether it be wet or dry, how is it accomplishing this? Well, there's other researchers that have been trying to delve into this, and there's been some follow-up that sauna definitely lowers the blood pressure. Now, what's interesting is it increases the blood pressure in the sauna, and it lowers the blood pressure, both systolic and diastolic, after the sauna. And that's an important distinction to make, because some of the adverse effects of saunas have to do with that lowering of the blood pressure afterwards. So, and other things that have been investigated is that sauna improves arterial compliance. So this is looking at non-invasive measures of pulse wave velocity, of the reactivity of our arteries. And there's no question of it that this has got to be one of the areas that saunas really make it an impact. It also increases heart rate variability, and heart rate variability is this cardiac or heart-related variable that is a marker of our autonomic nervous system. And that autonomic nervous system is what regulates our blood pressure, regulates things that we don't have to think about minute to minute, like how fast we're breathing and stress responses. And I think this is, again, where there's some of this, where some of these benefits are being shown. And also, in a few studies, there's been sauna demonstrated in sauna interventions to reduce markers of inflammation, and primarily C-reactive protein, which we do use a lot for cardiac diagnosis and cardiac-related inflammation. But it's also used as inflammation in a lot of autoimmune diseases as well. Now, sauna also has some negative effects. There's been some studies that have shown, and this doesn't always get promoted by the sauna influencers, and you don't hear about this on Instagram, but there was a really elegant study in 2013, and it's actually backed up by a lot of literature by an Italian researcher, Garola, who did a transcriptomics study of only 10, but when you're doing these types of gene array analysis, you can get away, you're powered for fewer participants to get results that are meaningful. And he quite clearly showed that male sperm, so it was these male athletes who underwent a 3-month sauna intervention. I think it was once a week for 3 months, and then had their sperm analyzed as well as gene array, sperm activity, and functional markers analyzed every 3 months from then after. And so at the 3-month mark, there was no question that it was impaired. Not only were the numbers of sperm lowered, but it's also all the functional markers were lowered, and a lot of the gene expression of those functional markers. And then at 3 months after ceasing the sauna, there was still some evidence, but it was starting to improve. And by 6 months, it had completely reversed. So it is a reversible adverse effect, but it is important, especially with a lot of the young men that are taking up sauna bathing, especially in the kind of weightlifting and athletic realm, and especially if they're trying to get pregnant with a partner. That's an important thing to notice. And then there's another really interesting transcriptomic study that was done out of Saudi Arabia, where they did it was a very large gene array in blood, and they were looking at mononuclear cells, so a type of white blood cell. And what they found, and they would take the blood before a 15-minute sauna and after. And what they found is that the set of gene expressions, whether it's positive and negative expression, closely matched a lot of stress-related, so emotional stress-related responses. And they thought that was interesting because there is all this talk about hormetic stress, good stress versus bad stress, but they didn't expect to see kind of some of the bad stress markers show up too. And one of their thoughts is that this was instead of a positive placebo type response, that this was a nosocomial, or not nosocomial, it was a negative placebo, a nocebo response, because these Saudi Arabians, they felt punished getting into a sauna from where they live in their environment. So, and also they were having their blood drawn, which is very stressful for a lot of people. And one of the researchers that I talked to that was involved in this study said he really thought that some of this couldn't be teased out between their fear of having their blood drawn again. So you've got to realize a lot's happening in the sauna, and it has a lot of systems are getting activated. But still, this is the extent of most of the negative stuff that we see around saunas. That's not to say that there haven't been some adverse side effects noted in a lot of these interventional studies, as well as the observational studies, but most of it is mild to moderate level. Things like some lightheadedness, some transient leg pain, airway irritation, There was some reports of claustrophobia. But again, there weren't any serious adverse effects reported in all these studies that I looked at. And there were no reports of ambulances needed to take people, for their heart attacks that we all worry about with those placards hanging on public saunas. So that was interesting, and that was different than what we're finding around people who frequently sauna bathe, which hadn't been really looked at until the second project of my PhD, where I decided to do a cross-sectional study where I asked people who sauna bathe a lot, what are they doing? Who are they? Where do they live? What are they? It was called the RMIT Global Sauna Survey. I ran it for a year. It was online. It was a 72-item survey, so there were a lot of questions. So it wasn't a light one. And I was, yes, I would have liked 1,000 responses, but actually, when I think about it, getting at least 500 to completely answer all 72 of those questions was pretty amazing. They came from 29 countries, mostly Finland, US, and Australia. And that's probably a reflection of how I could promote the sauna. But other interesting findings is men and women were equally responding. So this idea that we're studying men, but I think a lot of women out there are sauning too, and we're not capturing those responses. It's changing now. I'm starting to see studies being more inclusive of women, but not enough yet. And then another interesting thing is that over 80% of them said that saunas really noticeably improve their sleep quality, and not just for one night, but for 2 nights. And again, have I seen a study looking at sleep outcomes and sauna? Not yet. There's not the funding. There's not the, I'm amazed that we haven't done that yet. And that's something that I'm trying to do at least one-on-one with a lot of my patients, is sleep track with these wearables and see what's happening with sauna activity. The adverse effect profiles that people reported were pretty similar to what we see in a lot of the studies: dizziness, dehydration, headache. Again, most were rated mild. Interestingly, there were 2 reports of severe that required hospitalization. This is different than what we're seeing in the controlled sauna interventions. And the 2 were, one was chest pain. And this man did say, and he was living in Finland at the time, and he did say, yes, he had a heart attack. And but he also said to me, he didn't really think it was sauna related. He just think that the sauna tipped him over the edge, probably, to have that. And then there was another woman who had really severe eye irritation, and she lived in one of the Baltic countries. But anyway, she mentioned that she had to be seen in the emergency room because her eyes got so irritated. And that was an interesting thing to note, because I hadn't heard anyone talk about having any eye issues in the sauna. But yet, after seeing this and dug into the literature a little bit more, turns out there's some ophthalmology literature where they use little mini eye saunas to help with a type of blepharitis, which is an inflammation of the meibomian glands that are in your eyelids that help moisten your eyelashes. And that they were using saunas to actually help with that, to help clear and promote secretion. But it's interesting, that eye irritation, that's going to come back, because that's something that is popping up. As far as motivations, it was heartening to see that 100%, meaning at least of the 500 that completed all the questions, all of them said it helped reduce their stress, it relaxes them. Almost all of them said they enjoyed it. There are people that don't enjoy the sauna. We do need to recognize that too. This is not a cure-all for everything. But then other things like relieving aches and pains. A lot of people do it for socializing, like I did in the beginning. And improving circulation was number 5 that came up, not number 1, as you would expect. And then in terms of about a third of the people that I polled had medically diagnosed conditions that they thought were improved by the sauna, but they weren't the cardiovascular ones I was expecting. I mean, number 1 was back pain. Number 2 was a mental condition. And number 3 was musculoskeletal pain. You don't see high blood pressure. You don't see heart failure on that list. So what this told me, and what this told me, and I'll come back to this, is that, no, sorry. What this told me is that people who frequently sauna bathe are not sauna bathing for the medically researched benefits, and that these need to be better studied by the medical establishment. We're ignoring a whole population that could be, all these populations that could be improved from it. And the other thing I did in this survey is I embedded a quality of life scoring tool that looked at, it asked 12 different questions. 12 of the 72 that I included had questions around mental as well as physical well-being. And I was surprised that when I looked at frequency of sauna and analyzed around the well-being scores, it was higher mental well-being scores the more you sauna, not so much higher physical well-being scores. And again, that's making me think there's more to this than just the cardiovascular physical responses that are going on. And in fact, there is starting to be some studies, especially coming out of UCSF from Chuck Raisin, and we'll go over another researcher at UCSF who's doing, that's looking at whole body hyperthermia. Again, here's this confusing terminology in the literature, but basically it's an infrared sauna. And this is a fascinating study because they created a sham sauna experience. So they used an infrared sauna that had a light. Well, most infrared saunas have a light that lets you know when it's on. And so they designed one that had a light that they could turn on even though they didn't turn on the sauna. And so they were able to control it and randomize it. And it was fascinating when I talked with him because he said some of the participants that were getting the real infrared sauna treatment were convinced they weren't getting anything. And then vice versa. There were some people that were that were in the sham and were convinced that they had an infrared. So there's definitely some mind influence. There's something going on behavioral around sauna as well. And we can't discount that. And this is that second study. This is by Ashley Mason, who is a clinical psychologist in this space. And she, like me, was foiled by COVID. It really put a damper on sauna research for a couple of years there because we weren't able to get together with people. And the sauna, despite there being reports that you couldn't get COVID in the sauna, I can say you can definitely get COVID in the sauna. So it was good that they did put a pause. But anyway, she was only able to get 12 through this single arm combination of using whole body hyperthermia with cognitive behavioral therapy. And they're looking for a target body temperature of 101.3, which is what you can usually get with infrared as well as most saunas. We're usually increasing our core body temperature by that much. But they didn't get all the findings that they were hoping for, but there was some promising. And I do think it's going to be coming up with, there needs to be more study in this area. And maybe not just in depression, maybe looking more at mental wellness in its whole facet, not just whether you're depressed or not. And sleep will play a role in that too. So let's talk about, well, what is sauna? What's happening in the sauna? I mean, or what we know about it. And this is another thing that kind of surprised me when I started digging into the literature. We don't really know that much about it. I mean, yes, we know we have thermoreceptors that take messages through the peripheral nervous system, take it to the hypothalamus and the central nervous system. And yes, our thermoregulatory center is the preoptic nucleus. And yes, that leads to autonomic nervous system activations, like we were talking about, as well as hormonal activations through the HPA axis, the hypothalamus, pituitary, adrenal gland axis. And these lead to increase heart rate, then decrease heart rate, increase blood pressure, then decrease blood pressure. And it's constantly reacting. And this leads to a shunting of the circulation to your skin. What I haven't written down there too is it also leads to behavioral changes that have been documented, again, in these weird oddball studies, but need to be taken note of. People become less aggressive. People become more open, have been observed to be more open to conversation. Teenagers, that's another one. Teenagers, sometimes this influence of heat, this is really untapped stuff that we don't know much about. And then, of course, sweating is is definitely the induction of sweating. And this is through the sympathetic nervous system, through cholinergic fibers. We're getting sweating, and then it is the evaporation of sweat that actually cools us through our skin temperature, then cooling down the central. Now, sweating is another thing that is really in its infancy of being studied. There are some evolutionary biologists who actually think our ability to sweat is unique and might be responsible for where we are in the chain of mammalian, in the ladder of mammalian behaviors, because we're one of the few species that can keep moving, keep running, for that say, from a predator or something, and still keep going, still able to move and control our core body temperature, lower our core body temperature. That's not the case for a lot of other mammals. And that was my criticism of a lot of animal studies is, certain, even cats, like look at the fastest when they've studied cheetahs and things. Yes, they can go really fast, but they hit a certain block. Once their core temperature just reaches maximum, they have to stop and pant. They can no longer keep moving. Whereas we have this advantage. We can run marathons. We can keep and it's really a superpower that is totally overlooked, I think, especially in medical spaces. We also spend we have a multi-billion-dollar industry covering up our sweat. We wear antiperspirants, we wear deodorants, and especially for us women, we're trying to hide the fact that we're sweating all the time. We're wearing clothing that will, so we've actually been running away from something that I think might be have health advantages. And we're also, if someone's written a book about the comfort crisis, the minute we get hot, we're turning on the air conditioning. The minute we get cold, we're turning on the heater. We're actually not utilizing a very important system. And we all know if you don't use something, problems are going to happen when you want to use it. And I think that's something that's going on with sweating. And then I didn't confess to this, but actually when I first started my PhD, I was almost going to change and do it in human sweat analysis because sweat was so understudied back then. It's starting to change now with some certain revolutions that are happening around the different omics types of, there's proteomics, there's metabolomics, there's genomics. All this analysis is changing. The single cell analysis is changing our knowledge of what's involved in sweat. We're also still trying to capture what are the VOCs, the volatile organic compounds in sweat. When you think of what we talked about, what is sweat designed to do? It has surfactants, things we can't completely understand, but it is designed to evaporate quickly. And those contain some interesting compounds that we are still trying to capture. We haven't even figured out a way to capture those, much less analyze them. And then there's the revolution of the microbiome. I mean, when I was in medical school 30 years ago, there was not even a discussion of microbiome. There was no even acknowledgement of all these different microorganisms that live on us and in us. And the skin microbiome is starting to take off this field, but I'm sure that there are going to be changes that are noted in people who regularly sauna, changing that temperature of the skin. It's going to change what kind of bacteria live on you. And that's going to be fascinating to see in the future. Now, again, getting into what are the mechanisms behind sauna. I love when I see, a splash from a sauna influencer saying, sauna, it increases your heat shock proteins. And I'm like, yeah, that's one of about 500 things that are happening, but that's good. I'm glad we're celebrating that. But it's really multi-system activations. And there's so many different things happening. And this should remind us of something. And the researchers are taking note of this too. This should remind you of exercise, and we're still trying to figure out all these postulated mechanisms in exercise. So it shouldn't be surprising that there's not one answer to how sauna impacts us. And like I said, there are different research groups that are they're looking at the fact that sauna mimics moderate intensity. intensity exercise. And this is the Finnish style sauna. And then there's the infrared sauna. That this was in my third project of my PhD. I did a clinical trial where I did a randomized controlled crossover trial, looking at comparing control to a control intervention to a exercise intervention. It was an indoor bicycling to an infrared sauna. Initially, I wanted to also include a Finnish style sauna, but the laboratory I was working at, their Finnish style sauna sprang a leak and I couldn't use it after getting 2 people through it. And I also focused on women. And what I found was that for the most part, yes, the cardiovascular responses were all similar between the exercise and the infrared sauna. But what was different is the level of tympanic temperature. So I'm a clinician, so we tend to do temperature measuring through the eardrum. And then also and I also did infrared temperatures of the skin, and I also looked at breathing rates, because I'm used to doing vital signs on everyone. And that's something that hasn't been captured in a lot of those other physiological studies, is they didn't really focus on the respiratory responses. And so what I found is that these women, and I used women as their own control. So that's what, when a crossover, I'm actually altering, I randomized the order that they did their interventions, but I didn't need to have a control group. I was using them as their controls. And no question of it, the infrared sauna compared to exercise was increasing that core temperature and also increasing the skin temperature. So markedly different. And I looked at skin temperatures in the forearms, back, and forehead. And all three, there was markedly less heating up of the skin with exercise as compared to infrared sauna. And then it was the breathing rate part that really, at the time, and when I was talking with other researchers, everyone was saying, well, of course, you don't have to breathe fast, you're not exerting yourself. But actually, that's a really important puzzle piece, I think, because this is what makes sauna a more accessible way to increase circulation for those who cannot exercise. So this is where I think sauna, this is the sweet spot, is it's not impacting your respiratory. And the respiratory system is involving its own stress. Every time we utilize oxygen, we are producing what's called reactive oxygenated species that our body, we have to get rid of. It's a metabolic toxin, but you don't have to do that in the sauna. You're not creating as much of that, yet you're still getting some of those sheer blood flow responses that we think are beneficial, that we think. Not just that, but there's also a sauna exercise synergy. And don't worry, I don't have too many more slides, so we'll be able to get to question and answer very soon. There's been, again, this is Eric Lee did this work, and he was a doctoral student under Jari Laakkonen in Finland at the time. He looked at he did a multi-arm study where he looked at exercise training for 8 weeks and looking at cardiovascular markers, and then also looked at the same group doing a 15-minute post-exercise sauna later time. And it was quite clear-cut. Exercise increased the cardiorespiratory fitness, but exercise and sauna, post-exercise sauna, further improved that, and it lowered blood pressure even more and total cholesterol significantly. So these are all things to take note of. And these are the kind of parameters that I think are going to be part of our how you biohack. So, that was the whole point of this talk, is how can we start to think about how to sauna bathe for what we want to do. And so some of the parameters are looking at frequency and time, and some of these narrative reviews have explored some of these findings I've shared, and at least looking at the Finnish sauna literature, sauna activity kind of 3 to 5 days a week with at least 20 minutes seems to be associated with better outcomes. And So that's one way we can look at using frequency time to, quote, dose the sauna. But we could also dose the sauna based on temperature and humidity. There's some great work out of a research collaboration in Poland that study both men and women separately in different studies that demonstrated that really when you're in a steam sauna as compared to a dry, and this one was more traditional sauna, there's definitely the high humidity leads to a reduction in our ability to thermoregulate. And that's because, going back to sweat, when we sweat, the way it is functional is it has to evaporate. And it cannot evaporate when the humidity level is over 80%. It cannot evaporate as well. And so as a result, core temperature, our understanding is the core temperature measures just increase very quickly. And that's why you can't generally stay inside a steam sauna as long as you can inside one of the drier saunas, like an infrared sauna or the more traditional style. And so that has led me to propose models, and we're in an evidence-free zone now. I want to study this and want to try and demonstrate this, but I kind of am suggesting, and this is when I'm working with patients, that we look at it, we create models that are analogous to the low, moderate, high intensity of exercise. And I'm using zones for those that are familiar, or looking at, the heart rate determined, what percentage of heart rate max reserve that you get. And so, for example, when I have someone that is, let's say, is elderly, and by elderly, I mean maybe over 75, and wants to use it for maybe cognitive benefits, I'll say, we're going to start with an infrared, start low, and monitor blood pressure and heart rate. And our goal is going to be looking at that lower heart rate target zone. Whereas if I have someone who, let's say, is an athlete who is training and wants it for performance, I'm going to say, well, I'm going to steer them more towards the high intensity, maybe using steam saunas to help get to help with to acclimate their cardiovascular output. And then for the moderate level, when you're especially looking at athletes that want to recover, or looking at for recovery purposes as opposed to performance purposes, I might be leading them more towards a moderate, or those that want to improve their cardiovascular risk factors. Then we might go more towards a traditional sauna. Again, this is not proven yet, but I think this is a direction to watch. This is a space to watch. Now, as I pointed out from different studies, and sauna isn't safe for everyone. And first of all, you need to be really well hydrated. If you're going to be sweating for prolonged amounts of time, sweat is still 99% water. There's a lot of other stuff in sweat, but still, it is primarily water-based, and that water needs to come from you in your sweat glands. And being hydrated doesn't just mean drinking water, but that's a separate presentation. But it's making sure that you're well hydrated. And when they've done studies of death in the sauna, two factors really stand out. One is drinking alcohol before or during a sauna, big no-no, as well as sauna bathing alone and not telling anyone else that you're in that sauna. So those two factors definitely can be really dangerous. There's risks. There's definite risks of falls and burns. When I was practicing in Australia, at least once a year, we would have a sauna-related burn. Someone fell over and onto their sauna stove. I even remember this young woman sleeping in her sauna, which I thought was crazy, and ended up having quite a severe burn. And then again, watching the eyes. The more I'm starting to poll people, the more I'm noticing that a lot of people do notice eye issues. So I think there's more study that needs to be done around our eyes. What's going on with the different heat exposures in eyes? And definitely, who shouldn't be sauning? Well, if you've had a recent MI or heart attack or stroke, and by recent, I mean within 3 months, no, you shouldn't be near a sauna. And people who have any kind of labile blood pressure issues like severe aortic stenosis, or which is becoming more common now, autonomic instability, POTS syndrome. Anytime you just got to be careful. They're not absolute contraindications, they're more relative contraindications. We talked about males who are trying to optimize fertility. Again, that's a relative contraindication. Pregnancy is a bit of a thorny issue because you talk to any women in Europe, almost all of them have used the sauna during their pregnancy. Yet, when you look at the guidelines from OBS and gynae communities, they're starting to change, but they tend to be quite restrictive. I also sauna during my pregnancy, but I used common sense. I did not sauna the way I would normally when I wasn't pregnant. And I think that's leading to a point that I want to make about that we need to be individualizing sauna prescriptions the same way that we individualize exercise prescriptions. And this is another thing that as a practitioner, I can tell you is that, yes, it is great. Exercise has wonderful benefits, but prescribing exercise is, and getting people to maintain an exercise regime can be really challenging. And I've found that it's a lot easier to get people warmed up into exercise by starting with sauna first. But then again, this is all anecdotal in at this point. So conclusions, look, we need a lot more research, of course, and we need more practical study designs. How people sauna in a laboratory is very different than how people sauna in the real world. And we need to try and capture that. And I'm hoping to get some citizen science studies going where people are using wearables and sauning the way they want to and personalizing it to them, and then start to look at the results and the findings. And we need to research beyond cardiovascular benefits. We need to really focus especially on mental health, chronic pain. And then here's a population that I think is fascinating is the perimenopause symptoms. So when I did the global sauna survey, there were a number of separate responses, separate women who commented that they thought the sauna bathing helped with their hot flushes. And that was interesting because when I started my studies, I was perimenopausal and I didn't have any hot flushes either. I have no idea if it was because of the sauna or not, but there is some research coming out now that vasomotor symptoms, the intensity of the vasomotor symptoms, is being correlated with the load of cardiovascular disease. So this is an interesting space that I think deserves some special attention. The other thing is who's going to be prescribing saunas? Is it going to be GPs like myself? I don't think that's likely. I think GPs are too busy with other stuff right now. Is it going to be sports doctors, exercise physiologists? Maybe. Is it going to be cardiac rehab nurses? Possibly, if we're able to get it into the hospital setting like they do in Japan. Or is it going to be musculoskeletal rehab? Not sure. And then, of course, we have to update the public health education for both sauna users, so they realize some of these research benefits, but also the health medical professionals, so they're aware of what some benefits are too. And I hope we're not going to be as slow to adopt sauna into medicine as we have been with exercise. Because I don't know, I know some of you are old enough to maybe remember in the 1950s, 1960s, there was Jack LaLanne and Jane Fonda and their exercise routines. And that was before exercise was kind of a thing. But it wasn't, at least here in Australia, until 2006, until exercise physiologists were recognized and their services were Medicare rebatable. So let's hope we don't have to wait this long. So again, take-home points. Sauna has multi-system activations that are very similar to exercise. And it has the physical and mental health effects, again, very similar to exercise. There are different intensities of sauna based on the type and the different parameters we talked about. And the health effects of a sauna are going to vary by individual. All right. Sorry that took so long.
That was an absolutely fantastic talk, Joy. I learned a lot. I'm going to ask one question that I have. And if anyone else has a question that they'd like to ask, I would say raise your hand or put the question in the chat, and then we'll go through and call on people. My question, Joy, is something that I'm sure you also see with other things in health, such as good food and exercise. Have there been studies looking at kind of socioeconomic differences with access to sauna? And I wonder if in places like Finland, it's something that's more equally accessible, but perhaps in a place like Australia, it tends to be more of a wealthier population that has access to sauna and has information about sauna. Have there been any studies looking at that?
There have, and again, it's in Finland, because one of the criticisms that came out of that 2015 study is people saying, well, that's because people can afford and have more accessibility, and those that have more access to saunas are able to sauna bathe more frequently. But even doing accounting for that analysis, they are still seeing benefits beyond that. But again, it's mostly in Finland and in Europe that I've seen those studies. I have not seen them yet in places like Australia, US. So it's a good question, really good question.
Yeah, I imagine, like with other things in health, that could be a barrier to implementation because it's not inexpensive to invest in sauna, and it can be hard to access. So.
Well, and that's what I'd like to change, at least here in Australia, I'm trying to do, especially before the Olympics here in Brisbane.
Yeah.
Let's have more public saunas. And dry saunas especially are not that difficult to upkeep and keep and run, as opposed to steam saunas. Steam saunas create more of a public health challenge, but we could definitely do better maybe with pop-up saunas, and we definitely have to open up our ways of implementing sauna, no question of it. And definitely not just hospital setting. Hospital setting is probably the worst place to try and introduce saunas, I think, actually.
People are not going to be eager to rush over to that environment if they don't have to.
No, exactly.
Right. Robert has a question. He's asked me to read it because he's on the train. He is wondering about the use of sauna in combination with cold plunge, which I think is really trendy right now, and if there's any research on that.
There is emerging research. I'm going to confess I am not on top of all that research. There are definitely there's researchers out of Europe. There's a very Susanna, I'm trying to remember her name, out of Denmark that is doing some fascinating work on it. Look, there's no question of it, but it's the whole other end of the thermoregulatory spectrum that's getting activated with cold plunges. My suspicion, based on the reading I've done and looking at the studies, is that yes, it's another way to dial up the intensity on activation of the thermoregulatory system. But do I think it has the same benefits? No, I think we're talking about a different application. But does it have applications? Sure, I think there are going to be. And I guess this is a good time to mention, well, what are the health benefits that I noticed with the sauna? I didn't want to start with that, but I have an autoimmune condition, Raynaud's syndrome, where the circulation in my fingers and my toes, it's lifelong. I've had it since being a teenager. Any kind of cold exposures like skiing, any kind of stressful, like giving a talk or something, I would get these painful spasms in my fingers, especially. And that's what I'm also a heavy exerciser. So I'm a regular exerciser. So it was interesting to me that my hands, as long as I sauna every 2 weeks or so, I forget that I have my Raynaud's syndrome. And that, to me, is what was profound. Now, Raynaud's is a vascular condition, so it's falling within the research benefits. But that's not what gets prescribed to people who have Raynaud's. I mean, I had tried all kinds of calcium channel blockers. I tried nitroglycerin paste. All of those things work, but I'd much rather just sauna regularly than have to take those things to control that disorder.
Mm-hmm. Great. Well, I see David has his hand up. Would you like to ask your question, David?
Thank you, Evelyn, for coordinating today, and Joy for an excellent presentation. If you'll excuse the pun, I threw myself in the deep end when I went saunering, which included 20 minutes of 90 degrees and then a cold shower. and I got very elevated heart rate with a cold shower on my chest. So I did some research, and basically the research I found said, don't do that. It's very silly, particularly for older men, because you can, have heart attack. So, I'm wondering why Finnish men are not dying from heart attacks when they jump off the end of the pier into the freezing cold water. I also read that the brown fat argument is a bit of a fallacy, that the amount of brown fat that you generate from, that type of sort of cold plunge is actually minuscule and not worth the effort. So I'm just wondering if you've had the opportunity to look at similar research in a more structured way and have a perspective that might be helpful. But at this point, what I do is cold shower one arm at a time and then one leg at a time, and sort of build up to where I'm cooler and my blood pressure starts to get back to normal.
How long have you been doing that for, David?
Oh, a number of years now. I've been a biohacker for about 5 years.
Okay. So you've kind of answered your own question in a way, because what you just did is analogous. Let's talk about it in exercise terms. You tried to run a marathon when you hadn't trained. And that's exactly what you did with that contrast bathing and especially high intensity. You went straight to, when I talked about the models of sauna intensity, you started with high, and which really, as I was saying, your population, not knowing your whole medical history, I would have said, why didn't you start with an infrared sauna? Or
that's not my style. But it does explain why old Finnish men are not dying by the truckload.
Right.
So thank you for answering my question.
They've had decades of working up to that.
Okay.
And as to your second question about brown fat, there is some recent evidence that this brown fat controversy, there is some evidence. The trouble is it's taken out of context a lot. Most of the brown fat studies are around babies. This is when brown fat activation is probably at its highest as a neonate. But that's not to say that there isn't some brown fat. There isn't some evidence. And I find this very similar to the issues around detox. We didn't talk about this, which it's probably no. I should have mentioned detox, because that came up in the Global Sauna Survey as one of them. It wasn't the top motivation, but there were a lot of people who do it to quote detox. But when you look at the detox literature, detoxification literature, there is evidence that skin is a detoxification organ. It's just not on the scale that we really as adults see. Usually it's our liver and kidneys where a lot of the hard work of detoxification takes place. But that's not to say that when we're doing sweat analysis, and even in some of my studies, I'm finding evidence of pesticide, and this is doing really good quality where we do controls that minimize contamination, that there is evidence of various pesticides and insecticides that are coming out in our sweat, but they're just on a scale that's so little compared to what's coming out in our urine.
Yeah. Sorry, given I don't see any other hands up, I might ask a quick follow-up question. And given that today is mostly around vascular health, can we move to cocoa? Because I also consume, quite a lot of cocoa for vascular flexibility, given my understanding of the research. And I'm wondering if that's been an area of research for you, or you direct us, because, I appreciate the benefits, but the cadmium and lead concerns exist, and I see the way that the chocolate industry is completely opaque to those issues for perhaps good reason. So I'm just wondering, to what extent you've had a look at that, or know of someone who has done the research for us.
I've probably seen what you've seen, but as a fellow chocoholic, and actually I combine chocolate with different mushroom extracts too, and find that certain mushroom extracts, not all. Again,
spermidine,
for me, it's lion's mane and reishi that are the two that I really find.
Oh, the two, yes. But for spermidine.
But look, this is an evidence-free zone. I've got to declare that it is the N of one that we're talking about here. And these are really difficult topics to study, because we don't want them to be industry-led, because that's just going to be full of bias. But trying to find the funding to study these things properly without that bias is just almost impossible. And sauna falls under that. Look at exercise, even when there isn't as much of this debate, we're still trying to figure out all the different effects that exercise has on us. So we got a long way to go, but I think it's a really exciting time to be in medicine because of these revolutions I talked about. We're looking at single cell analysis, which is more individualized. We're looking at the microbiomes. This is going to change our understanding. It already is. It's changing our understanding hugely.
I have another question, Joy, and then if anybody else has a question, please put your hand up. We still have a few minutes for questions. Joy, for someone who has not been a regular sauna bather, I'm in my 40s, and maybe I need to take this up separately and make an appointment with you. I imagine you maybe like exercise. You don't want to jump right in to do maybe 20-minute sessions 5 days a week or something, even with an infrared sauna. Is it good, like with exercise, to start slowly and build up your comfort? What would you recommend to a sauna beginner?
Definitely. And that's where a lot of people shoot themselves in the foot, is they just, as David was mentioning, just try and do something with,
because then it's also not going to be enjoyable, right? And then you probably won't stick with it, just like with exercise, right?
Exactly. But it's also these behavioral and individual issues. And that's the other thing that I'm just not, and this is the hard part about when you look at sauna being promoted, is it's not the cure-all to everything. And there are going to be issues, but you're the only one that can answer that question if it's going to end up being beneficial for you. But definitely, I totally agree. That's start slow, start at the low intensity. Unless you really have an established exercise fitness. And that I didn't show the studies, but there's definitely a correlation with good exercise fitness and good sauna fitness, which has other terms. Thermal flexibility is the term that's becoming more popular to define that sauna flexibility. But there's no question that people who are already more exercise fit can slot into sauna activities a lot easier. And here it's mostly in athletes. Whereas people who are sauna naive are not big exercise, haven't been engaging in exercise lifelong, you need to go slow. It's going to be a shock to the system, literally. And especially if you've been living like most of us, where you've got air conditioning, you've got heaters. So this system has laid dormant for a long time. And in fact, it's one of the reasons, one of many, but I think that we're starting to hear more about hot flushes being a problem around women. I think 50 years ago, when we didn't have air conditioning, we didn't have as good of heating, I think that thermoregulatory system, I think people were sweating more, just living their day to day. Whereas we've really dialed down the ability to sweat properly. And I think it's a key health parameter, as I was saying. I think it's a key superpower that we've been dismissing and actually, ignoring for a long time. So it'll be interesting. And when I've had friends, so I've introduced sauna to a lot of friends, and it's very funny because I have some friends who say, "Oh, I can't sauna. I do sweat. You just trust me. I don't sweat." And I'm like, well, you wouldn't be standing talking to me if you didn't sweat, because we're all physiologically sweating to a minor degree in our day-to-day living. No question of that. And I have used the kind of time to sweat is what the variable I call it. That's kind of a marker of how conditioned you are getting to sauna. And what I've noticed in especially some of these female friends is that their time to sweat may start off being quite large, even in an infrared sauna. Sometimes it takes them 15 minutes to sweat. And then as they start doing it more regularly, suddenly they're saying to me, "Oh, I'm already sweating," and it might only be 3 minutes into our session. And I'm like, see, it's working up, it's conditioning. And I suspect that's the same way with exercise. So, that's what it is.
Great, Joy. Well, I don't see any more hands up. So what I want to do is just take 30 seconds, because Robert asked me to do this, and just remind everybody that it's very exciting on the 1st of October, there's actually an in-person event in Sydney called the MIT Tech Connection Down Under. It is associated with an aerospace event, a conference, but you don't have to be in the aerospace industry to attend. You don't even have to be technical. I was joking earlier that I studied geology at MIT, and people used to say that I went to the humanities department because it wasn't a hard science like engineering or physics. It doesn't matter what you studied at MIT. The purpose of the event is really to connect alums from all disciplines. So everyone is welcome to attend that event. I very unfortunately can't attend it because I have a conflict with another conference, but Robert and team will be there, and the registrations are up to about 50 people. So have a look at that event. I'll put the link in the chat now. And with that, I will say thank you so much to Joy for presenting today. And I'm sure there'll be many more questions that maybe come your way through your practice or so on. And we really thank you again for your talk. I certainly learned a lot, and I think others did as well.
Great. And thank you to those that responded to the survey, because I will read through all of these and try and get back to you if there's some questions that didn't get answered.
Fantastic. I've just put the link in there for how you can register for the event in Sydney. And we will see you at our next virtual coffee, which will have some time in Q4, and our next virtual talk, which will probably be in November. Thanks, everyone. Have a great day.